Well, just a few moments ago, you would have seen a spokesperson for Cosatu in KwaZulu-Natal claiming that he does not believe it is their members responsible for some of what's been happening around our hospitals, around the country. You will have seen entrances being blocked, patients not able to get the care that they need. Cosatu, the federation to which Nehawu belongs, now calling for a peaceful and disciplined strike. Their parliamentary officer is Matthew Parks. Matthew, good afternoon to you. What are you calling for here?
Good afternoon. No, thanks. Look, so, as Cosatu, we support the strikes by any of our trade unions. This is part of the labour market framework of the country. People have the right to strike, and that's provided for in law. And the demands of Nehawu members, the public servants, are legitimate. They are aggrieved by getting below inflation increase over the past few years, and in 2020 get no increase. So government needs to engage with them in good faith. And whilst we said, we also remind ourselves and to all workers, whether they're in Cosatu unions or outside of Cosatu unions, that whilst we exercise our right to protest, to strike, to picket, to demonstrate our grievances, this must be done within the framework of the law and the Constitution, which requires them to be done peacefully. We encourage workers to support strikes by other workers, not across a picket line where relevant. But again, it must be done peacefully. There are workers who are required by law, like nurses and doctors, who are essential services, like police officers and so forth, who have no choice but to go to work. And they should not be attacked when they do so. Of course, health care is an essential service because patients' lives matter. There can be real consequences in terms of fatalities if patients don't receive the medication, the treatment, etc. So workers, be they paramedics, be they doctors or nurses, who are required by law to treat these patients, should not be interfered with. They should be protected and so forth. But I think for us, what we need right now is calm heads. I think the interview and the call by Nehawu for peaceful demonstrations, we support that wholeheartedly as Cosatu. I think we appreciate the work that Nehawu's leadership is doing on the ground to try to calm the situation and say to members, let's peacefully protest. We support that call. We also want to appeal to police officers, to security guards, to also help cool the temperatures. When they have to respond to issues, they should do so in a peaceful manner, which doesn't fuel the tensions, etc. See how can they negotiate with the striking workers to, abide by the various picket lines and so forth. But I think right now, our call as Cosatu is for calmness. Let's try to resolve issues. Government needs to engage with the unions, including Nehawu, at the PSCBC in good faith. Let's find a solution because the grievances of the workers are 200% legitimate. They are drowning in debt. They need to see government finding a way to address their concerns. Let's look at creative solutions. We think there is a facilitation process tomorrow at the PSCBC. We encourage all unions to participate in it. We also encourage the government to go into negotiate in good faith because we've been raising this point for some time, Stephen, that since the previous Minister of Finance literally tried to destroy collective bargaining, it has poisoned the labour market relations atmosphere. And if government wants to achieve as many progressive objectives, we need to repair the broken relationship between public servants, between nurses and teachers and police officers and the state as an employer. We can't afford to simply pickpocket public servants because of the billions lost to corruption, to state capture, to waste and expenditure. So I think for our side, let's find each other, let's negotiate. Let's not allow anyone to become the victim of other people's failures. And I think also as a trade union federation, we remind all of our members that we are premised upon working class solidarity. The patients who go to hospitals are workers. They should not become the victims of other people's failures, in particular government's failures.
I mean, Matthew, you would have heard, I know you would have heard the spokesperson for Nehawu in KwaZulu-Natal explaining to our reporter, Nabukla Modise, that he believes they're saboteurs, that the violence isn't caused by Nehawu members. Frankly, I'm not convinced. I don't know if our viewers are convinced either. This violence, this preventing of patients from going into a hospital to receive medical care would not be happening if Nehawu wasn't on strike. I find it difficult to believe that it's not Nehawu members involved in this.
Yeah. So I think first we must be guided by principles and the rule of law, and the rule of law applies to everybody. So workers have the right to picket and so forth, but patients also have the right to go to a hospital. No one should interfere with that right. The police are obliged by the same laws to uphold the laws. So they've got the right, the obligation to protect workers who go on strike, and they have the obligation to protect paramedics, emergency, essential healthcare workers who need to perform their duties to do so. And they also have an obligation to make sure that those patients who seek care, emergency care especially, from our hospitals are allowed to do so. So it's a very emotional situation. And again, that's why I think there's a need for calm leadership on all sides, from workers on the ground, from trade union leadership, from management of hospitals, from the police, from the state, because I think further fueling the flames is not going to help. It's going to make matters worse. And I don't think any of us should want to see a single patient dying because of somebody else's failure to negotiate properly.
Matthew, you call for calm, so let's take a breath and let's just look at some of the dynamics that got us here. And you're right to point to the previous Minister of Finance. You're talking, if I recall correctly, about Titu and Mboweni, what happened just before the pandemic, the budget that year. Also then, we have all of the other dynamics in our society. So very high inflation, higher than it's been for, 13 years. We've got a situation where our government simply doesn't have more money. We all know this. We all know the problems of Eskom. We all know the situation, the state that we're in. Let me call it that. So here's the concern. The concern is that the dynamics that are leading to what we're seeing outside hospitals now are only likely to grow more intense. Inflation, particularly food price inflation, is going to remain high for some time to come. Interest rates will probably have to go up. The point is, the dynamics that got us here are going to be with us probably for the rest of this year.
No, that's true. In fact, the dynamics will be even beyond this year. Unfortunately, we're kind of in the epicenter of a storm. We've got multiple crises, from load shedding to cable theft to an economy that has shrunk in the last quarter to 43% unemployment. The state is also bleeding billions because of corruption and mismanagement, a stagnant economy, etc. Workers, too, are also struggling, be they in the public sector, be they in the private sector, from wage stagnation, below inflation increases. We don't really have the luxury of which crisis to choose, which to respond to. Unfortunately, we have to respond to all of them. It might not always be to our liking. There is a needed time to compromise. And I think the basis for any compromise is always for parties to negotiate. We had raised alarms that if government walks away from the negotiating table in 2020 or 2022, it's going to poison the matter and it will get out of control. And that's why we've been saying constantly, government needs to find a way to repair the broken relationship between the state as an employer and between public servants, but not only for the public servants to have their issues addressed, but also for the state to manage its own situations, to address as many multiple crises to address. We need to find a win-win solution, a solution that leaves public servants feeling their rights are respected, that the employer does value their contributions, that they are assisted to take care of their families. Equally, we need to also ensure we don't collapse the state, because the workers depend upon the state for public services, be it healthcare, education, policing, roads, rail, etc. So it is a very messy situation. This is again why we need to see sober leadership. We need to find ways to negotiate. It's not going to help if government simply says, well, we're not going to negotiate, because fine, government might think it wins the day in terms of budget, but it's just creating a further chasm between the public servants who government depends upon to deliver public services and the state as an employer. So we do really need to find a win-win solution which respects workers' rights, respects the needs of society, and empowers the state to deliver upon its mandates.
Matthew Parks, thank you very much indeed. The Parliamentary Officer for the Congress of South African Trade Unions, of which, of course, Nehawu is a member. And you'll have seen our reporting from our reporters in the field about the situation outside government hospitals. Well, of course, more to come. More from the National Department of Health in the Pulse later on Newzroom Afrika, Channel 405.